Cohen.
Dr. Korean, Dr. Kasirye.
Alexander, if you could head to your room for Russian, that would be awesome. Great.
There is no Russian.
Alexander, I will help you in the chat, but we are going to go ahead and move on. So Dr. Kasirye and Dr. Cohen, welcome, and thank you all for joining us.
Okay, I see it. It looks like, are we started?
Really excited to talk to you all about COVID-19 today. Just a welcome reminder for our interpreters that you should head into your rooms. Otherwise, we hear you alongside us, which can be a little confusing. But if we could kick off with Dr. K and Dr. Cohen telling us a little bit about what is going on within COVID-19, and then we will get straight into the questions for the community. And so if you're a community member, don't hesitate to start to put your questions into the Q&A. All right.
Everyone, can I go ahead? Okay, good evening, everyone, and thank you for joining us. So I'll start with just a summary of our numbers, and then I'll turn it over to Dr. Cohen. As of this morning, we have 126,002 cases of COVID-19 reported to Sacramento County. When you look on our dashboard, it does say that we received 1,017 new cases today. That's a little on the high end of what we've been receiving. We've been getting about 500 cases a day. Part of the increase is due to some backlog, but I think it is a reminder to us that we are still in a surge. And even though we saw a slowing down of our case rate a while back, it seems like it is picking up again. The case rate for this morning was 33.1 per 100,000. And with the deaths, 1,839. And we did have an additional 5 deaths today. You may have heard us in other reports stating that the deaths are still remaining low because we are getting maybe 1 to 2 per day, but it has picked up, and this is typical of what we've seen in previous surges, where we initially see an increase in cases, then an increase in hospitalizations, and then that is followed a few weeks after with an increase in deaths. And that is, I think, also an indication of the path that people usually go through when they first get infected with COVID-19. When you look at our hospitalizations, we do have over 400, I think there was 428 cases in the hospital, and 100 of those are in the intensive care unit. If you look and compare with our previous surges, we have surpassed the surge for the summer, which was in July of 2020. And we seem to be on pace to actually get to, or maybe even exceed, especially with the hospitalizations, the surge that we saw at the beginning of this year, of winter of 2020-21. So there are a lot of things that are concerning to us. And so we continue to put the message out about masking indoors and vaccination, because right now those are the two strategies that we have to help us to get through this surge and to turn things around. I wanted to point out that if you go to the vaccination tab, we do have some additional information on there. This is because a lot of times people have asked us whether there is still a difference that we're seeing between the vaccinated and not vaccinated. About 80% of our cases, 80 to 90% of our cases are among people that are not vaccinated. And when you look at the second graph, you see that the 7-day average for case rate by vaccination rate, you see that for those that are not fully vaccinated, which is the red line, it is pretty high, and it's at about 44 per 100,000. And then the blue line at the bottom for people that are vaccinated, it's about 10 per 100,000. So that gives you an idea of what the risks are. We've been putting messages out reminding people of the importance of vaccination. It does help to protect from infection, from severe disease, and from death. And we are seeing that in our numbers. Hospitalizations, majority are among people that are not vaccinated, and that's the same with the cases as well. Lastly, I know that there are a number of state health orders that have come out. I won't go into details into the health orders, but just to mention that several of them were targeted towards people in healthcare for vaccine verification and testing, and actually it's healthcare and congregate settings. And then today it was announced that starting in September, that large events, indoor events, will be required to do vaccine verification and verification of a negative test in order to attend the event. With that, I will turn it over to Dr. Cohen.
Okay, I've officially unmuted. Thanks for once again inviting me to participate. For those who haven't been on before, my name is Stuart Cohen. I'm the Chief of Infectious Diseases at UC Davis Medical Center across the street from the county. And I try to give a little bit of a perspective as to what we're seeing in the hospital. And I think there are a couple things that are really important. First, the number of cases right about, I don't know, about 3 or 4 weeks ago, I think, as Dr. Kasirye brought up, we looked like we were getting out of this. And all of a sudden, now we have about 10 times as many people in the hospital as we had 3 or 4 weeks ago. We've sort of flattened out. Actually, the number went down a little bit today. So I'm trying to be optimistic, but it's hard to really tell what's going on. About 10% of our tests are positive. So just in relationship to vaccine versus non-vaccine, to my knowledge, we have, it's about 3 to 5% of the patients in the hospital are fully vaccinated. And there are another 3% maybe who have had first doses of vaccine. And then the other 90-some% are unvaccinated. And the people in general who are in the ICU and who are on ventilators are unvaccinated. I've been so busy recently, I haven't really had a chance to go back and look through the charts of some of the people who are breaking through and are being hospitalized to see whether they could have been an immunosuppressed patient or somebody who might not have optimally responded to the vaccines. Regarding our healthcare workers, we've seen an awful lot of our healthcare workers turn positive, almost uniformly from things that they're doing outside of work. Or if at work in break rooms and things like that. And I think that there was just that relatively brief period of time when everyone was told to toss their masks. And I think there was a lot of, and it happened here, it happens to coincide with when the new classes of medical students and residents and all these other people come in. And so there are a lot of get-togethers in relationship to that. Most people have very mild symptoms, if they have any symptoms at all, with the breakthrough cases. But I think it does actually point to exactly what the new CDC and federal recommendation will likely be relating to booster doses of vaccine or third dose of vaccine, whatever you want to call it, for even non-immunosuppressed people. So I don't want to waste a lot of time in the introduction, but I think this one point is important. I think when we first were testing these vaccines, what was being tested was whether patients had symptomatic COVID or not. And so when Pfizer and Moderna said that their vaccine was 95% effective, it was 95% effective against people having symptomatic disease. It was never clear that only those 5% of people who had symptomatic disease actually were the only people who were infected. There were probably asymptomatic infections involved, but none of the studies really looked for that. But what we've seen now is a switch so that there are a lot more symptomatic people, again, even if they're mildly symptomatic. And it's really happened, and I think it may be partially related to the Delta variant, and it may just be related to time. And either way, what we're seeing is now more people who have mild symptoms, but they have symptoms, and they would have been considered failures of the vaccine if they were participating in a clinical trial back then, to the point that you've seen data coming out from the CDC suggesting maybe 60, 70% protection as opposed to 95%. The number of people who are severely ill and hospitalized remain very low, as I mentioned earlier, but there are more people who are getting infected, who are having symptoms, and who are potentially transmitting to other people. And so that's why we have to get people back together again and start the vaccine process again for those of us who've already taken it, and why we have to encourage all the people who have not taken vaccine to get vaccinated. The more the virus multiplies, the more variants are going to show up, and the more variants are going to show up, the more chances there are to develop something that will render the vaccines less useful. So it's really urgent to get people vaccinated and put a lid on this thing, right? This has been 18 months. I think everyone's getting a little tired. And so let's get it over with.
All right, that's going to be our theme for the night. Let's get it over with. Appreciate that, Dr. Cohen, and big thank you to our team. We've had some technical difficulties, so appreciate you all rolling with things here. We have some outstanding questions that have come in for the community, so we're gonna just circle over to that. And as a reminder, if you have a question, you can go to the bottom and submit it through the Q&A function. All right, our first question. Is it feasible for Sacramento County to report on the website graphs that show the number of hospitalized patients who have been fully vaccinated?
So that's a good question. The reason that we do not have it on our dashboard is that the database or the data set that we use to be able to get the information on hospital cases does not have information on vaccination. So in order to get that information, we either have to request the records and pull information from the medical records, which does take time, or we have to be able to do matching with another data set, and that is not easy to do, so not easy to do on a weekly basis. So we have now been able to provide that information in our Board of Supervisors updates twice now, and we're hoping that we can do it at least on a monthly basis. But for the hospitalizations, it is a little more challenging to get the vaccination status.
All right, so we have a question from a community member that's wondering, their unvaccinated aunt and uncle now have COVID. Their doctor gave them remdesivir. How successful is that treatment? and are doctors giving it here in California? What about hydroxychloroquine? I might be saying that a little incorrectly.
That was good enough. I think so. So remdesivir is the only drug that's FDA approved to treat COVID. Or at least the only pure antiviral drug. And I'll mention an alternative also for both treatment and prevention. But remdesivir is the gold standard for treatment for people who are hospitalized, who are on oxygen. That's when it provides the best effectiveness. It shortens the duration of illness. It may decrease the risk of somebody actually progressing to needing to be on a ventilator. Once somebody is on a ventilator, remdesivir alone is not gonna cut it. So it's best in these sort of in between people, not outpatients and not the people who are most sick in the hospital, but sort of the in between people in the hospital, and it will shorten their illness as well as decrease their risk to progress. Regarding hydroxychloroquine, there are no data to support that it's useful. In fact, some of the data has been considered fraudulent. One of the primary proponents of hydroxychloroquine is in a little bit of hot soup right now, and so I don't think that it makes sense to even worry about it. The other drugs that you guys should know about as community people, and hopefully all of my medical colleagues are aware of it, is the role of the monoclonal antibodies. So the one that we are using predominantly is a combination of two drugs called casirivimab and indevimab, but most people know it as the Regeneron monoclonals. And that will take high-risk people who are not hospitalized and potentially prevent them from having to become hospitalized. The other thing that it also can do is if you're a high-risk person who is exposed to somebody who has COVID, and it can be given as a prophylactic medication as well. So it has some uses in both the less severely ill people, but particularly less severely ill people who are likely to progress on. So people who are very overweight, people who are diabetics, people who have underlying lung disease, that may prevent them from ever having to be hospitalized. And the other point is if you have high-risk people who are exposed to COVID cases, using that monoclonal antibody combination can decrease the chance that they'll ever end up getting infected and getting disease. And it's worked very effectively even in skilled nursing facilities. So that's a great drug in our armamentarium. And then remdesivir is good for the intermediately ill patients in the hospital.
Great, thank you. And is it known yet what the risk is of getting long COVID in vaccinated people?
It really isn't known yet. There's some suggestion that there may be cases, but it's not really clear. There are no real publications in relationship to it. I think it's a little bit too early to get a good sense of what's going on with the breakthrough cases in relation to long-term complications.
Okay, so stay tuned, folks. Please address natural immunity in regards to why it's not being treated the same as the vaccine.
So I guess I'll take that too. So I think the issue with all coronaviruses, and I think everyone was even aware of this when they were thinking about vaccine, because remember that coronaviruses before COVID are one of the most common causes of the common cold. And the reason that you can get infected year after year is because immunity is very short-lived, typically 3 to 6 months. And so after somebody gets natural disease, first of all, their antibody response is not as high as somebody who's been vaccinated. And the expectation would be that their immunity would wane probably more rapidly even than with the vaccine. And so that's why we're vaccinating even people who have been infected and who have had prior disease. Sorry.
No, that was great. I really appreciate your thorough responses to community questions. I love it. So, people are really curious about boosters and are wondering what is going to be the procedure for scheduling boosters. Will they get to choose between Pfizer and Moderna, or do they stick with the first shot they received? Can someone just talk us through boosters?
Okay, so there are data that say that it's probably safe. There have been studies with in Europe with the AstraZeneca vaccine, followed by the Pfizer vaccine. And there are studies in the United States that are mixing and matching. So if there's no availability of the vaccine that you previously got, I don't think there's a problem with you getting the alternative, at least between the two mRNA vaccines, the Moderna and Pfizer. I think that the goal is still going to be to get everybody the same vaccine that they got the first time through.
And I just wanted to add to that, because the question was also, what will the process be? So right now, the third shot or the booster dose is recommended for people with immune compromised conditions. And so what we are advising is that people check with their healthcare provider first, because their healthcare provider will be the best person to be able to talk with them through whether this is necessary for them or if it's a good idea for them. With the public clinics that we have, because we still have a lot of people that have not received the first or second dose yet, we are still focusing on the areas with low vaccination rates and communities that have low vaccination rates, and that is where our focus will be until we actually get to the point where everybody is at least 70%. We've also heard reports about everybody being eligible for third dose later on in September. We don't know how that's going to work out yet, because it has not been approved by CDC and FDA yet, but of course it's now being discussed by everybody. It's probably going to follow the same order, especially because it's supposed to occur 8 months after you finished your first series. So those who got it first will be eligible first, but wanted to also point out that it is not as urgent as when we first rolled out our vaccination one. We have a lot more vaccine available now. So I think clinics and appointments will be a lot more available. And also it's not as urgent because as we see from the data, there's still protection with for those that are fully vaccinated. And so even if it goes beyond the 8 months, it's not a big issue. You can just wait and get it when it's convenient.
All right, so it sounds like you all may want to join the next community forum too in about a month, because we might have some more information for you around boosters. So we have some community members that are really interested in staying social but doing it safely. We have one community member that wants to know, how they have a group of older adults regularly attending monthly gatherings, to stay connected. They range in age from 60 to 90. They're all fully vaccinated, but do have their monthly meetings sometimes indoors, and they do have food there as well, and are just wondering, should we hold those meetings? Should everyone be masked? Should we not have food and beverages? How can we stay safe?
Well, right now we are not canceling any events or telling people to cancel events. And some people are finding ways of being able to do it safely. I think you've mentioned that one of the most important things, which is that everybody is fully vaccinated. You can also just make sure that there's an understanding between all of the attendees of this group, that if someone does have mild symptoms, that they do not attend, or if they have been knowingly or know of an exposure to someone with COVID, that they do not attend the meeting. Some people go as far as also doing the antigen test. Right now, that's a lot more available than it was way back. So some people do that so that they know that when they're going for this meeting, they do have a negative test as well. And as far as masks, definitely as much as you're able to continue to use the mask, but of course, if you're going to have eating and drinking that during that time, when you're actively doing that, you can take the mask off.
Thanks, Dr. K. Dr. Cohen, were you going to say something?
I was just going to say also that I think that, you know, I mean, the last couple days have been pretty brutal outside, but for the most part, if you can do it outside, and this has been, we've been relatively lucky this summer, although I'm looking out my window and I'm not feeling that way right now. I think that would be obviously the best of all worlds if you could pull it off that way.
Awesome. So yeah, Dr. K and Dr. Cohen talking about the multiple layers of protection that folks can consider and hopefully utilize as they're trying to stay safe. And, you know, a lot of folks have families and children are going back to school. So can you update the community on how kids under 12 are trending now that schools are opening? And is County Health able to assist if a school is not enforcing the indoor mask mandate?
We are beginning to see more cases among children, especially as more schools are opening up. We do have a school team that coordinates very closely with all of our schools to get reports of cases, provide guidance for contact tracing and making decisions on whether who needs to quarantine and for how long, and also on the testing that needs to be done. And as far as for schools that are not following the masking mandate, we do initially start with education, and we also, as in some situations, will send a correspondence to remind them that this is a state mandate and that they do need to follow it. We also do need to remind people that since it is a state mandate, the state also does have the authority to come in and do enforcement. If they find that they have gotten multiple reports from a certain school, or if they're seeing problems with a lot of cases and uncontrolled outbreaks. So we do work with the state as well.
And is there a timeline for vaccines for individuals under 12?
I'll leave that for Dr. Cohen.
I've been told that it might be October to November when they'll have the data on the younger kids, but I'm not certain about that. Some of these timelines have been slower, although, you know, as the case rate picks up, it becomes a little easier to finish vaccine trials, because I think I mentioned this on one of these before, but the way that people tell whether a vaccine works is you have a placebo group and you count the number of cases that they get, and you have a vaccine group, and it's the comparison of the number of cases between the people getting the vaccine and those not getting the vaccine. So if there's a lot of disease around, you can get a lot of cases, and then you finish faster because you get to a point where you can actually do an appropriate statistical evaluation of the effectiveness of the vaccine. So not that you want it to be like it is right now, but I think the fact that it's happening will accelerate some of the vaccine timelines.
And we'll take one more school question before we pivot to a different topic. With numbers rising, should schools be organizing periodic testing for all students and teachers like LA has started doing?
We have not actually approached that question. I know that previously when schools were opening during the last school year, there were recommendations for testing. That is not part of the recommendations from the state this time around, but definitely if we are seeing a lot of cases, that's something that we will look into.
I would say that at Davis, there is going to be mandatory testing for unvaccinated twice a week. We're going to do the same at the medical center, twice a week vaccinations. On the main campus, for even vaccinated people are going to probably be getting tested every other week. We're still talking about that on the healthcare side. There are bigger implications with taking people off of work in a healthcare setting. So we have to really look at that a little bit more closely. But I think that it is a good idea. And the capacity, you know, we have a sort of a homebrew test at UC Davis that uses saliva, and they can run about 8,000 tests a day. So we also hit a cap where we can't do any more because there are too many tests. And I think that's another constraint that potentially fits into how much testing anyone can do.
I think that's a great segue into just a little informational point here, which is that there is testing available in the community. So Sacramento County has a number of testing sites that are available, and there are other testing listed on our testing webpage. So you can find all this information online, and I'll put the link in the chat. And then we have a bunch of non-county sponsored COVID testing locations, as many of our testing sites are seeing some wait times. But just as Dr. K and Dr. Cohen mentioned, a couple different layers of protection, testing is one of those. So since the viral load of the Delta variant is reported to be 1,000 times more than other variants, does that mean we should be physically distancing beyond 6 feet?
So first of all, what it means is there's a lot more virus, and I won't bore you with my hypothesis as to why it's so high in the upper airways, but there's a lot of virus in the upper airways, and that just means it's more transmissible. It doesn't mean that it flies necessarily further. And so again, we sort of know over the course of the last 18 months, we've learned a lot, and we know that there's probably, in the right setting, there's more aerosolization, and it sticks around in the air in longer periods of time. That's why we like outdoors better than indoors. And we also know that if somebody's screaming, that it's probably going to go more than 6 feet. But for normal speech and normal talking, It just poses a higher risk of infecting people because there's a lot more virus coming out, but it doesn't necessarily require you getting further away. It does, again, point to the benefit of both people involved wearing masks to try to cut down the amount of virus that first gets through the infected person's mask, and then that gets further diminished going through the potential recipient's mask.
Got it. So 6 feet is probably a good, still a good benchmark for community, even with these changes. And can people who receive the vaccine still contract COVID?
Yeah, I think that's what we've been talking about with the breakthrough cases. So the majority of people who get infected will have no symptoms or mild symptoms. There are occasionally people who break through and end up being hospitalized. And again, those breakthrough cases are part of the motivation towards giving third doses of vaccine and trying to boost antibody concentrations higher than what they are as they diminish over the course of 8 months.
Okay, so I heard a strong yes to that. And a follow-up question to that was that, you know, this community member's wondering, okay, you can get COVID, but can you transmit it to other people?
Yeah, so that's an interesting question. I can't. I think this is probably a strong yes too. I use a lot more words to give a strong yes than Liz does, and so I think that people are shedding virus for a shorter period of time if they've been vaccinated, but they can still have a lot of virus in their upper airways, so they can transmit. I think that there's been some evidence of transmission already in the literature. I don't think it's as easily transmitted. And again, the viral amount goes up high and then it comes down much more quickly in people who have been vaccinated.
I also wanted to point out that that is the evidence we were looking at when we decided to issue a county health order for masking indoors for both vaccinated and unvaccinated. Because even though we know that people that are vaccinated have a much lower chance of getting infected, a much lower chance of transmitting, but that there is evidence that it does occur. So for those reasons, our mandate does require masking for both vaccinated and unvaccinated indoors.
Got it. And Dr. K, we have some more questions about, folks who are getting vaccinated and are looking to potentially do some activities. And, someone says, how do you prove you're vaccinated? Should I carry my vaccine card with me at all times? Kind of like a driver's license. And my vaccine record doesn't show up on your site. I have sent in, I'm not quite sure, I've sent in my card and ID for your site.
So a couple of things. One is that the best way to do it, rather than travel around with your card, well, one thing is you can travel around with the card, but another way is taking a picture of it, because then when you do have to show your verification, showing a photo of the card is sufficient. Another way is to go to the state website and get your information that comes as a QR code, and then you take a picture of that, and businesses that have the special QR code reader are then able to verify vaccination that way. Because a lot of people have been trying to access the state system and found that their records are not in that system, they have contacted us. So as you can imagine, we have quite a number of requests that have come in. Some of them we are able to fix on our end by simply correcting the information that is in the state database. But oftentimes we actually have to send it to the state to correct. And since they're getting it from all different counties, I think that they're a little behind. So we just ask that you remain patient. If you want to check up on the status, you can send an email to our COVID vaccine email address and just request to find out whether it has been corrected or not.
And I'll put the email address in the chat in just a moment. Are vaccinated and masked people who are meeting indoors in a church, for example, any more at risk than they were, say, 3 months ago?
That's a tough question. There are a lot of factors that you're bringing into play. My thought is that especially if people are vaccinated, definitely it has a huge, huge, huge impact on reducing the risk. But of course, meeting indoors, and especially depending on the activities, if people are singing, if somebody does happen to have COVID, there could be a certain risk there. But again, I think the most important factor is being vaccinated because that provides the best protection.
Got it. So we have some questions about young people who are getting COVID. We have a community member that wants to know what is the death rate for ages 18 and under. And I'll see there, I think there were a couple other ones as well, but we'll start with that one.
I know that we have shared that data before at one of our board updates. I do not have it handy, but we could, I guess, find a way of sending whoever the person inquiring, we can send you the information that you are requesting. The death rate is still low for people under the age of 17. I think it's important because this is a question that has come up several times because people have said, well, it seems like children tend to get mild disease. Why are we taking these measures of having children use masks? And I want to remind people that one, a lot of the children, especially those below the age of 12, do not even have, are not eligible for vaccination. And so no protection at all with the vaccination. And then the other is a reminder that when this whole pandemic started, the schools were the first institution that was closed. And that was because of the concerns we had about what impact COVID-19 could have on children. And for a large percentage of last year, the schools were closed. So that prevented the exposures in a congregate setting that the schools present. This is the first time with this new school year that we are actually having children in school, in person, without social distancing. So that means that all the children are in school. And so we do have to take preventive measures as much as we can. And right now, the best preventive measure that we have is the masks. I know that we have received reports from other states where they are seeing a lot more children getting very severe disease with their pediatric intensive care units filling up. And we have also in Sacramento County had some unfortunate deaths of children less than 18. So it's not a benign disease, and we do need to continue being careful and taking measures to protect our children.
I would agree. There are a handful of kids hospitalized here at Davis now. Not large numbers, but some of them are really sick and may not survive. So I think I think it's important, and I guess sometimes I worry a little that people focus on death rates because even at 1.7 or 1.8%, which is about the mortality rate in the United States, if you've got millions and millions of people getting infected, that's still an awful lot of people dying. And so, right, if there's a disease where 10 people get infected and 10 people die, it's 100% mortality, but it's 10 deaths as opposed to hundreds of thousands of deaths that we're seeing in the United States. So I caution people to getting too focused on those percentages, because again, when you're dealing with thousands and thousands of cases, a low rate still causes a lot of problems. And I think about every once in a while, I think back and think about if you had a case of meningococcal meningitis in a school, how everyone would be flipping out, and everyone would want prophylaxis, and everyone would want their kids vaccinated. And I don't know why this doesn't bring the same concern, where meningococcal disease in 2021 is almost like getting hit by lightning.
I agree with you entirely, and also wanted to point out that I think people also forget that even for people that end up surviving, many of them do end up with a lot of complications, lung damage, having to be on oxygen, having other complications as well. So I think those are important things to remember. And as Dr. Cohen pointed out, I think one of the concerns with COVID-19 is just how many people it can infect. And therefore, even with a 1% death rate, that translates to a lot of people if half of your population is getting infected.
All right. Well, I think this dovetails nicely into a question from a community member about information sources. And so they're wondering from you, both Dr. K and Dr. C, where are you getting your information from? Let's talk about sources. And this is a great chance to kind of direct community to some trusted sources of health information.
I'll let Dr. C go first.
Thank you. So I get some of my information from Dr. Kasirye in Sacramento County. I get a lot of information from CDC. I'm a member of the Infectious Diseases Society of America. We have weekly or every other week conference calls, often with members from CDC or other institutions where some of the research is ongoing. I've been involved in a number of clinical trials, and so I have meetings in relationship to them as well, and learn information that way. And one of the things that has been amazing is how quickly and how large the number of peer-reviewed publications are coming out with COVID. So it's a lot to keep up with. And we've also seen an explosion of papers being published on these what we call pre-publication servers. And so I have a couple of listservs that sort of point me to articles that may be of interest, and then I can evaluate the papers once I've read them.
So I, with with us at the county, definitely being able to get information from the CDC, from CDPH, which is a state public health department. And then also, as Dr. Cohen mentioned, peer-reviewed articles. And sometimes I do have to review articles more critically because you do have to look at the methodology. Sometimes you do have to dig a little deeper and find out, the qualifications of the person who is writing this article. And I think those help to help us in deciding whether these are credible reports or not. But definitely being careful about the sources. I know that a lot of people get information online, and sometimes they will send it to me and ask, is this true? And the first question I ask them is, well, first of all, the person didn't even put their name on it. So you don't even know the source. And sometimes I have to remind them about the science behind what is being said. Because sometimes some of the stories that are being passed around are quite sensational, like someone getting vaccinated and all of a sudden the light bulb next to them lights up. And the question you ask them is, well, in your science classes, how does that make sense? And also like saying that they got magnetized, and you have to ask them, well, in your science classes, how does a body get magnetized? What would cause that kind of thing? And how can a shot that is less than a mil in amount immediately have that kind of effect? So just trying to talk through that and saying, I think that put aside all the sensationalism and think about it in terms of the science that you have. And also looking at probabilities, because sometimes people will put statements out, but don't look at risk, relative risk or probabilities, which are important when you are considering information.
Just think how much money you could make if you could magnetize humans, right? Right, it would be a total deal, right? I don't even know how people can really even think that that somebody is smart enough to figure out how to do that, right? The other thing that we see is this microchips that are tracing you, and everyone has a phone in their pocket that has microchips in it tracing you, and so no one needs a vaccine to get traced in the first place. A lot of times it just defies logic.
But to be clear, Dr. Cohen, vaccines do not trace.
Vaccines do not trace, vaccines do not magnetize, vaccines do not allow you to turn on a light by standing next to it.
Okay, thank you for clarifying. And if community members do have questions, we know that there's a lot of information out there. I'm going to go ahead and resend out the COVID-19 vaccine email address, and you can send your questions there. We have a team that is ready to support you and thinking through what sources of information are best to rely on. Okay, so what is the modified quarantine for school children that have an exposure to COVID-19 in their classrooms?
Good question. So this time around, when the state issued guidance for school reopening, they added modified quarantine, which refers to exposures that occur in the school environment between students. And if two students are both masked when the exposure occurs, say it's in a classroom and they are following the masking guidelines, they were all masked, and then a few days afterwards, one of them falls ill and gets a positive test. Then when the school officials are evaluating that exposure, because it is what we call a mask on mask exposure, it's considered to be a much lower risk. So in those situations, so long as the student who was exposed remains free of symptoms, they are allowed to continue attending classes, not extracurricular activities, but attending class. and they get tested twice a week for a period of 10 days.
You know, and another group that I know we heard a lot about earlier on in the pandemic was long-term care facilities. So Heidi's wondering, how are residents of long-term care facilities doing? How many breakthrough cases have happened in this vulnerable group?
Well, the good thing is that the long-term care facilities were among those that were first prioritized, and through the CDC contracts with pharmacies, they had a dedicated teams going to the long-term care facilities to get the residents vaccinated. So for many of them, their vaccination rates, especially for residents, is like 90 to 100%. And so we have started seeing some cases and some outbreaks in long-term care facilities, but they're nowhere close to the magnitude or the number that we were having in previous surges. And many of them, it's initiated by an employee that is not vaccinated. So that's one proof actually about the effectiveness of the vaccines. I can't give you a number. I cannot give you a number right now of how many breakthrough cases among the congregate settings. I'd have to go back and see if I can get that.
Thank you. And, you know, as we talk about, Dr. Cohen, you mentioned the booster shots. Debbie's wondering if the formula in the booster shot is the same as the first two shots, or has it been changed to deal with the Delta variant?
You know, it's the same, and that's an interesting thing. I saw some data presented that I don't think are readily available yet, that compared antibody responses in people who got a booster with the original vaccine, let's call it, versus a vaccine that was engineered to be targeting the Delta variant. And when you look at antibody responses, even to Delta, it's pretty much the same in both groups. That's why the boosters are being run out with the vaccine that's currently available. You know, ultimately, I think if we look downstream about this, we may be seeing vaccines very similar to what we do with flu, where there are a couple different strains of virus present in the vaccine. But at this point right now, I think just boosting the current response will be adequate, and there's no real benefit in developing a new vaccine specifically for Delta for people who've already been vaccinated.
Got it. And Dr. K, Karen is wondering, when will the mask mandate be lifted? What is the targeted data around this mask mandate?
Well, we did not set a specific number, but we continue to monitor. Definitely, if we start seeing a reduction in cases to the point, at least to the level we were at by June 15th, I think that will be a very good indication for us that we can consider lifting that.
How is the Delta variant identified with the PCR test? Can we tell what the spread of Delta specifically looks like when we're doing testing?
Yeah, so the routine tests that we do in the laboratory cannot tell the difference. So when you get a nasopharyngeal swab done, or a nasal swab, or even if you do an antigen test, you cannot differentiate. The way that you have to do this is somebody has to actually look at the genetic sequence of the virus, and look for the changes in the virus that are associated with the Delta variant. And what I think you can see from CDC's website and from other information, pretty much 100% of the cases in the United States now are Delta. if it's not 100%, it's pretty darn close to 100%. But for us routinely getting tested, we can't tell the difference.
So, we're talking about testing and being able to tell the difference. There's a kind of on a similar vein, a question about the breakthrough cases. Are we able to know what percentage of breakthrough cases were vaccinated with Pfizer versus Moderna versus Johnson & Johnson?
We have not done that assessment yet because in order to understand what the numbers mean, you also need to look at the percentage of people that got the different types of vaccine. Because we know that, especially because Pfizer is available for all the way from 12 years and up, we're probably going to see a lot more people that have received the Pfizer vaccine. So if we were to look at the breakthrough cases and see more of them with the Pfizer, that does not mean that the Pfizer has less protection. It just happens that more people have received the Pfizer, but we have not looked at that data yet. I wanted to go back to a point that Dr. Cohen made and make sure that people understand, because I have heard, or we have received questions about this from time to time. The test that we do, the PCR, is able to detect particles of the virus, and it is able to distinguish between COVID and the flu. So when someone is tested for COVID, and the test is positive, that is COVID. If someone is tested for the flu and the test is positive for the flu, that is the flu. We're able to distinguish that. What Dr. Cohen is talking about is that in order for us to be able to tell the different strains of COVID, there's a different test that we need to do called genetic sequencing. And sometimes we talk about it as a way of fingerprinting, and this is not a new process. You've probably heard us talk about different outbreaks. For example, when we're talking about Salmonella or Shigella, the way that we're able to tell and track the source of an outbreak is by using the genetic sequencing, because it helps us with the fingerprinting.
Great, thank you for breaking that down for folks, Dr. K. So Kathy is with a small nonprofit, and they meet weekly, about 30 people vaccinated en masse. And they want to know what their reporting protocol should be if one of their attendees comes down with COVID.
If it is a workplace, then they have to follow the Cal OSHA guidance for reporting. But all positive reports do end up with the county. If they had the test done at one of their healthcare providers, that healthcare provider is also responsible for reporting that to us. So there are several ways. And if they do wish also, they can also call and contact us to let us know that there is a positive, especially if there's more than one and we need to do some contact tracing.
So just to repeat that, it's Cal OSHA.
Yeah, Cal OSHA is the regulation body that provides regulations that for workplaces. So for workplaces, they are required to report certain diseases to the county, and certain outbreaks as well.
Got it. So we have a community member that's wondering, why is there no talk of living a healthy lifestyle to reduce the ravages of COVID-19? 95% of COVID deaths per the CDC have 4+ comorbidities.
I think it's a great point, actually. I appreciate that. I think that sometimes we get a little bit too focused on the special approaches that we have. But I will also caution that even somebody who's super fit and not overweight and doesn't have underlying medical illnesses can get severely ill with COVID. And so I don't think that the idea of allowing your own immune system to take control is something that we should be telling people. I do think that telling people to live healthy and lose weight and eat better and not to smoke, all that stuff is great for not just COVID, but a lot of other diseases as well. And that will decrease your chance of having something bad happen to you if you get infected. So I think it's a great point. I think we should be doing more of that.
I do want to point out, though, that for someone who does have chronic diseases like kidney failure, diabetes, just telling them to be healthy is not sufficient. A lot of people do need the extra advice that we are offering to be able to take care of themselves, such as being able to mask and vaccination as well. I'd like to give an analogy that I've given lately to some people as I'm trying to explain the reason for having vaccination as opposed to just depending on your immune system without the vaccine. All of us are very familiar with the Army and how it works and how people are trained and are then able to protect our country because they can identify the enemy and are trained to use the weapons. So if you can think of your cells as soldiers, basically when they get the training, it takes a bit of time for them to get the training. And so you want them to be trained before the enemy attacks, so that when the enemy attacks, they'll be able to identify, they'll be able to know how to use their weapons. So in the situation where someone is vaccinated, that is like going to boot camp, because the vaccine basically allows them to get the instructions so that they're able to identify the spike protein, and therefore they are ready. So, and usually that process takes about 2 weeks, minimum 2 weeks. So you can imagine that in that situation, someone is vaccinated, it's beyond the 2 weeks. Then if they are attacked with the virus, as soon as the virus enters the body, the soldiers are ready. They know what weapons to get, and they can get rid of the enemy right there and then, as opposed to someone who is not vaccinated and they get infected, then the soldiers are kind of scurrying around trying to figure out, okay, which weapon is going to work? Is it this one or is it that one? Who is the enemy? Is it this one or that one? And by that time, the virus is multiplying, and oftentimes, by the time the body is able to figure out the antibodies, the person is on a vent. And sometimes in those situations, the virus has overwhelmed the immune system. So just a simple way of looking at it. Yes, we all value someone being healthy and having healthy habits. But when you are faced with an enemy that is so strong, you also have to have these additional things to be able to assist.
That's a great analogy. And I think the one other thing to point out too, since we're all worried about transmission and moving things along too, is those who are not vaccinated are more likely to get infected, and then they're more likely to transmit. And so even if that healthy person makes it through the disease themselves without much in the way of problems, they may put other people at risk as well. This is right. This is again, I think military is a good analogy, right? It's somebody covering your back and making sure that you're as safe as you can be.
Great. Thank y'all. I've also heard it like an umbrella. heading out into a rainstorm. But sometimes when the rainstorm's so big, you need a rain jacket underneath your umbrella too, which might be your mask. All right, so Tanya is a psychotherapist in a private practice. She sees, or they see, a number of elderly clients. And the last few weeks, they've started seeing some only vaccinated people in their office, but they do share a suite with some other staff that see unvaccinated clients. Should they move to Zoom?
So I'll just speak for myself. I don't know if there's a great answer to that question. I think it's a personal preference. I've been running my clinic through this whole pandemic, and we offer Zoom or our equivalent of Zoom through our medical record to patients if they feel more comfortable not physically being in the office. And we see people are in the office, and we know that there are some of our patients who are not vaccinated. And so, but everyone's masked, everyone's moved in and out quickly, and we try not to have people sitting in waiting rooms for long periods of time, and other mitigating strategies. I think that question is a personal preference. If you feel like you can provide the same quality of care by Zoom and the patients are happy with it, then that's great. If you really feel that it's better to have them in the office, I think you just have to set up the environment so that it makes people as safe as possible coming into the office.
All right. So we will take 2 more questions, and then I'm going to put in the chat the email address if we didn't get to your question, which we didn't get to many. We got to many, but we also have many that are left, which just shows that you all have such engaged and interesting questions here today. And I'm also going to put the registration link for the Zoom webinar. When we did extend it, all the emails from the past couple months disappeared, and we had to re-engage you all. So don't hesitate to send out this registration link to your friends and community if you found this helpful. And we will take our last couple questions. What will be the procedures for large outdoor events regarding vaccines and testing requirements?
Those guidance had been sent out before, and then they were updated recently. So for large events, they, if they're indoors, and especially after September 20th, for any indoor event that is more than 1,000, they will be required to do vaccine verification and also get verify that attendees have a negative or either vaccine verification or a negative COVID test. And it is recommended for outdoor events. And we've been asked about churches. I think it's recommended for churches as well.
Got it. As we send our children back to school, the protocols for schools seem more relaxed. Yet the Delta variant has made COVID-19 far more transmissible, and children seem to be more vulnerable. How do the current county safety protocols address this greater transmissibility? Are masks enough to protect our kids when they're indoors all day?
Well, masks definitely do, especially when used properly. We know that they do provide some protection. We also, of course, do remind parents, if your child is sick, if your child has been exposed, that you do inform the school and keep your child at home. Yes, we do have some concerns, especially with Delta and how transmissible it is. So we're working with the schools. Elk Grove Unified School District has been opened for a little bit now, I think a month or so. And they have had some cases, but they've been able to remain open. So our hope is that as the rest of the schools open up in the last week or so, that we'll continue to be able to assist them with remaining open and making sure that we don't have any large outbreaks.
Got it. So we have an anonymous attendee that said, great job, Dr. Kasirye, Dr. Cohen, and Liz. Thank you so much for giving your time to us this evening. Keep up the good fight for our community. And we want to thank you all for keeping up the good fight against COVID-19, because it really depends on all of us. So let's start with Dr. Cohen and then end with Dr. K on any kind of closing statements out to our community.
I would like to thank everybody who's attended and particularly people who've been attending all the way through all these community conversations. Knowledge is power, and that's what's going to help us get through all this stuff. And I personally feel really almost honored that these guys keep bringing me back, as goofy as I am. And so I think we hopefully have provided people a lot of information. We are moving forward in a way that that is hopefully going to get us into a better place. And when we meet again in a month, hopefully we're not talking about numbers going up. We're talking about getting things controlled and starting to plan for finally some existence after this pandemic.
And we'll bring back Here Comes the Sun when that's the case as our opening song. Dr. K?
Well, definitely want to thank you all again for taking the time with us, and also the very good questions that you are asking. We appreciate that. I also want to thank all the interpreters because they help us to be able to get the message out. We know that Sacramento is very diverse, and so we want to be able to provide the information to all of our communities. I want to thank Dr. Cohen. I know that you have your own fan club from this, and I'm sure they would be very disappointed if you were not on with us. We really appreciate that you are taking the time. We know you're very busy, but we definitely appreciate the all the experience and wisdom that you bring, and the clinical expertise as well. So thank you for continuing to be on this. And want to thank Liz for continuing to facilitate. I know sometimes you have others help you, but I know you've been kind of the champion for this. So thank you for continuing to facilitate and making sure that we get accurate information out to our community. So good night.
All right. Thanks, everybody. Good night.